I'm Jess. I work in the pharmacy on the third floor of Hall-Perrine Cancer Center as a pharmacist. And our primary duties are compounding medications for patients. We have a oncology clinic, infusion clinic, and so the pharmacy's job is to sterilely compound all the chemotherapy and pre-medications we give patients. We also have an outpatient pharmacy that we fill prescriptions for our cancer center patients as well.
My name is Deb Ratchford, and I am a pharmacist here at the Hall-Perrine Cancer Center Pharmacy. Like Jess has said, we provide a lot of service to our patients here at the clinic, and we also provide support to all the staff and any questions that they have about medications, and we make sure that all of the drugs are delivered in a safe manner. We have special systems set up to make sure that there's no exposure of chemotherapy to our staff and our patients and everybody that's here at the clinic. So during the mixing process that our technicians work through, they are dressed in sterile garb in the mixing rooms to maintain sterility of the environment. And so once they're mixing the medications, after we have approved that yes, it's good to go ahead and mix that product, they will move the drug from the syringe into the IV bag. And once that is completed, then what happens is the medication gets transferred then out to the not as sterile room, what we call the anteroom, and then can be passed out to the front part of the pharmacy, which then gets passed out to the nursing side through several different pass-throughs. And that's kind of the process of how the medication gets out to the patient.
So at the Hall-Perrine Cancer Center, safety is kind of our number one thing. So there's a lot of backup checks, double checks, triple checks, things like that. And that goes along with our workflow. So a patient will usually see the doctor, get labs usually. The doctor is going to verify that today's a good day to give the therapy, and then they'll sign the orders. And then the patient will go back to the infusion suites with the nurses. The nurses will also double check and review, make sure everything's safe, question the doctor if they have any questions or anything like that. And then they'll release the medications. And by release, that sends the orders over to the pharmacy, and that's kind of where we come in. So we'll look at the order, and we're also double checking all that. We're checking, has it been the right amount of time since they had the last therapy? Are their labs okay to get therapy today? And then once, say I'm the first one to get it, I do a first check, and then Deb's also going to come in and do a second check. So we do a two verification on all chemotherapy for patients. So two pharmacist eyes are on every order. And then once we verify it, once we both have agreed that it's safe to give that day, a label will print for the technicians in the IV room and the sterile rooms. And from there, the tech can collect any medications, IV fluids, and tubing they need, and then they can start to compound. It's taking multiple things and putting them together to make one thing. So a lot of times it just involves the right fluids. So we use what's called normal salines, which is a specific concentration of salt, basically salt water. Sodium chloride. So a lot of medications go in that, or like a dextrose solution. But with those fluids, they need to be compatible with the medications we put in. So a lot of times it's just drawing up a medication in a sterile environment and putting it into the bag in a sterile environment.
So there are many different chemotherapy medications, or even non-chemotherapy medicines that are immune therapy that we're using for patients that have both cancer or hematological disorders. So, and all of that is specialized to be used for whatever particular disease that we are treating. So there are many different drugs. We use some drugs, the same drugs for different conditions. It just depends on what works for that particular disease.
We also just have an open window. So yeah, anytime a patient were to want to, they could come up to the window and ask us questions, and we can do our best to answer kind of whatever the questions they have. But occasionally patients back in the infusion suites while they're getting their chemo will have questions about their their specific therapy and things like that. So we definitely do our best to try to help them with that. I've been up here about 5 years now total, and I've never dread work. I always love coming in, and the primary thing is just the community. The patients are all great. All of the nurses are great. The physicians are awesome. I always hear great things from patients about their specific doctor. I've never heard negative things about any of the physicians up here.
I have been working with the oncology clinic for several years, and I always think in my head I am very fortunate to have the position to help patients like we do, and to work with a group of providers and nurses, and all of the staff at HPCC are so dedicated to our patients, and we're always working for the best solution for each and every one of them. It's tremendous that we are all focused on taking care of our patients.